Patient came to my office with severe throbbing pain on her upper front teeth. She is 30 years old, Asian female. The pain is started like 4 days ago and it's getting worse since then. It's spontaneous, also stimulated by chewing food or anything touch these front upper teeth. It hurts. She's taking Tylenol and Advil over the counter, but they are not helping anymore. The pain she's having is causing her to have migraine-like headache on her right side of the head. She never experienced this before. Vital signs all within normal limits except for the temperature, which was a little bit high, 99.8 Fahrenheit degrees. There is no medical issues with the patient. She's only taking over-the-counter Tylenol and Advil alternatively, and they are not helping anymore, as we said before. She is not allergic to any medications. She never had surgeries. She never been hospitalized. The patient was referred to my office by her co-worker, who is one of my patients too. On a scale of 0 to 10, she said that her pain is 10 out of 10. Clinical exam reveals tender teeth number 6, 7, and 8, but number 7 is the worst of all. Also, there is a fluctuating swelling on the facial vestibule of these teeth. All upper front teeth responded normal to dry ice test except number 7, which has no response. Lymphadenitis also were noticed on the right submandibular lymph nodes. We took a periapical X-ray and showed there is about 2 centimeters in diameter radiolucent cystic-like lesion associated with the apex of tooth number 7, surrounded by a cortical or corticated margin, very clear, like half millimeter in diameter, all around the lesion. This tooth also has a root canal and a post plus crown for about 10 years ago. The crown margin looks a little bit maybe having some recurrent decay. The root canal looks satisfactory in the X-ray except for about 1 millimeters of underfilling, which I don't think is a big deal in this case, but might be. She hates her crown and she likes to change it. This is another thing. Differential diagnosis, treatment options, and treatment. So on top of the list is periapical cyst, which is infected, periapical granuloma. We cannot exclude the possibility of other odontogenic cysts or tumors. Treatment options discussed with the patient, which include incision and drain for the time being to help her relieve the symptoms she is suffering from, followed by either an RCT retreat and a new post and crown on tooth number 7, or do an apical surgery with retrofill and take a shortcut for that. Biopsy might be needed if the patient didn't heal well or didn't respond to the initial treatment. Treatment was started with incision and drain. The problem with such cases is to get the patient numb. When we have acute infection, it's almost impossible to numb the patient with conventional lidocaine anesthetic. So I choose to use a special strong topical analgesic or anesthetic called AAA topical plus P by Dr. A. Molina. Placed on the fluctuated mucosa for about 5 minutes, and with the help of number 11 blade, I just incise the swelling, and the pus mixed with blood start coming out without any effort. Patient got great pain relief instantly. Amoxicillin 500 milligrams were prescribed, and asked the patient to start with 2 capsules every at the beginning, then 1 capsule every 8 hours till finished. Post-operative instructions given. PO checkup was scheduled to be after 1 week. Patient never came back. Her coworker said that she went back to Hong Kong as required by her job. 2 years later, patient showed up. She had swelling and pain on her right side of the hard palate. Crown and post and root canal filling material was already removed from tooth number 7 by a dentist in Hong Kong about a week ago before the patient came back to the US. I took some pictures, and as you see here, there is, crown number 7 is gone. Tooth looks like broken. Another one shows you a couple of things here. An open canal of number 7, and the swelling on the palate shows some redness too. So my question was, how may I help you now? Patient wants pain relief. She wants to save her tooth, and she wants the swelling on her palate to go away. Without promises for the results, I said, I will try. So I started with root canal on tooth number 7, placed a fiber post and prepared the tooth for a new crown, placed a new temporary crown, prescribed amoxicillin, and got her about 2 weeks or 4 weeks later to cement her permanent crown. The pain is gone actually, and she felt much better. Swelling in the palate was gone too. And let's start looking at these x-rays one more time. This is the first x-ray when she came the first time in 2013 with that big lesion. This is the x-ray we saw a couple of slides away or before. This x-ray was taken on her second visit after she came back from Hong Kong. As you see, the cystic lesion still the same, maybe a little bit bigger, and the root canal material, the crown and the post, all gone from tooth number 7. This was taken 3/2/2015. The same day we did the root canal on tooth number 7, and 3/2/2015. As you see, the root canal material with some cement coming out of the apex. After she got her permanent crown, again she disappeared. Her job required her to go to Hong Kong and come back here every few months. So 10 months later, she showed up again for follow-up, and we took an x-ray for tooth number 7. Interestingly enough, that I can see there is good healing radiating from the periphery of the lesion, going centrally, and the amount of new bone forming is quite good enough within these 10 months. Date of this radiograph was January 22nd, 2016. Actually, it was yesterday. It was about cone beam CTs. When I have an interesting case, I have the machine, so I take cone beam CT. So the first one was done on her second visit on 3/2/2015. And that's what we see. It's a quite big cystic lesion right to the root of tooth number 7. It is perforating the palatal cortical plate, which is considered a very dense cortical plate, and thinning the floor of the nose too, if you look carefully here. Interestingly enough, that the facial aspect of the facial cortical plate of the lesion part is still sound, although it has something in certain areas. So after 10 months, yesterday we took another combi MCT just to compare what happened now. As you see, we have really good healing. The cortical plate on the bottom side almost healed completely. I can see tiny bit here needs to grow back. I see some bone formation. Still we have part of the lesion still there. Hopefully it will heal with time. It's just a matter of time. But the healing comes from periphery. That's where it usually starts. And the central part still needs more healing. This X-ray looks a little bit different, unfortunately, than the first X-ray, because I find that my machine is having some issues. The sensor is formed of 4 different parts or plates. The bottom plate is like burned, as you see in these sections, and for the company, they want to replace the sensor with a new one. So never underestimate the natural healing power of the human body. Just remove the insulting factors and let it go. These are my references, and thank you for listening.